In the global fight against chronic disease, obesity is often framed as a risk factor for diabetes, hypertension, and heart disease. While these links are well publicized and widely accepted, the relationship between obesity and cancer mortality remains underappreciated, even in scientific and public health discussions. Despite growing evidence, few people are aware that obesity is now a leading contributor to cancer deaths worldwide. This lack of awareness has dangerous consequences, delaying preventive action and allowing a major cause of avoidable mortality to advance largely unchecked. Obesity is associated with an increased risk of developing at least 13 types of cancer, including those of the breast, particularly in postmenopausal women, colorectum, pancreas, endometrium, kidney, liver, gallbladder, esophagus, and ovary. Yet the story does not end at risk of diagnosis. Obesity also negatively affects cancer outcomes. Individuals with obesity are more likely to be diagnosed at later stages, to receive less effective treatment, and to die from their cancer than their normal weight counterparts. In some cancers, such as pancreatic and liver cancers, obesity significantly worsens prognosis, partly due to the metabolic disruptions that drive both tumor development and progression. The biological underpinnings of this deadly relationship are complex and insidious. Excess adipose tissue is metabolically active, producing hormones like estrogen and growth factors, such as insulin-like growth factor 1, IGF-1, which can stimulate uncontrolled cell division and prevent the normal death of damaged cells. Chronic inflammation, common in people with obesity, creates a tumor-promoting environment in the body, especially within the abdominal cavity. This systemic inflammation and insulin resistance not only increase cancer risk, but make tumors more aggressive and less responsive to treatment. Beyond physiology, obesity complicates cancer care in practical and logistical ways that are rarely acknowledged. Imaging can be less accurate in people with higher body mass, leading to missed or delayed diagnoses. Surgery becomes more technically challenging, increasing the risk of complications and extended recovery times. Radiation therapy may be less effective, and chemotherapy dosing becomes more complicated due to differences in body composition and drug distribution. All of these factors contribute to poorer survival outcomes, but because obesity is not traditionally categorized as part of the cancer care pathway, its role is often minimized or overlooked. This oversight is especially dangerous in younger populations. Rates of obesity among children and young adults have been climbing steadily for decades, and emerging data suggest a parallel rise in cancers that were once considered rare in these age groups. Colorectal cancer, in particular, is increasing in adults under 50, a demographic trend that cannot be explained by genetics alone. Obesity is a prime suspect, but because most cancer screening protocols are not designed for young people, these cancers are often detected too late. Young patients may also face delays in diagnosis due to biases that assume their age protects them from serious disease, compounding the consequences of obesity-related risk. While smoking cessation campaigns have made impressive gains in reducing cancer deaths, obesity remains largely unchallenged as a preventable cancer driver. Public health messaging rarely connects excess weight with cancer in a direct, urgent way. This absence of awareness leads to missed opportunities for prevention, both at the individual and policy levels. For example, people are far more likely to seek out a cancer screening if they know they're at risk due to family history or smoking, but few recognize obesity as a similar red flag. The healthcare system itself often fails to intervene early, treating obesity as a personal failure rather than a clinical and societal challenge that deserves medical attention. Moreover, the global rise in obesity is accelerating faster than healthcare systems can adapt. In many developing countries now undergoing rapid urbanization, dietary shifts and sedentary behavior have triggered sharp increases in obesity rates, particularly among women. These regions often lack adequate cancer screening, prevention, and treatment infrastructure, meaning that the rise in obesity-related cancers may result in a steep, unmanageable increase in cancer mortality over the coming decades. The cost, in human lives and economic burden, will be catastrophic unless urgent action is taken. This is not merely a question of personal responsibility or lifestyle choice. The environments that promote obesity, cheap calorie-dense foods, car-centric cities, screen-based work and entertainment, and aggressive marketing of processed products are socially engineered. Without systemic intervention, the burden of obesity-related cancer will continue to fall disproportionately on low-income, marginalized, and younger populations. These groups often have the least access to early diagnosis, healthy food, safe physical activity, and quality healthcare. That makes obesity not only a medical problem, but also a social justice issue in cancer care. The silence surrounding obesity's role in cancer mortality is dangerous. As long as the conversation is dominated by heart disease and diabetes, we will fail to address one of the most critical and growing sources of preventable cancer death. It is time for this narrative to change. Public health campaigns must clearly link obesity to cancer, not just as a vague long-term risk, but as a direct, immediate threat to survival. Policymakers must treat obesity with the same urgency applied to tobacco control or infectious disease. Medical professionals need more training and tools to help patients with weight management, not just to improve quality of life, but to prevent premature death from cancer. The connection between obesity and cancer mortality is not speculative, it is scientific fact. Yet as long as this remains a hidden link, the consequences will be measured in lives lost, treatments failed, and futures cut short. It is time to bring this silent threat out of the shadows and into the center of cancer prevention and treatment strategies worldwide.